It's time to set the mood. Music. Not that. Music. Yes, that's good. Now, you have that loved one. You move in for the kiss. Then it occurs to you, wait, is there a kissing disease? Do I need to be worried? Why, there is a kissing disease! I'm Dr. Michael Berglund. Welcome to Common Sense Medicine. Today the topic is mononucleosis. The disease is actually called infectious mononucleosis. Most people know this as mono. They also used to refer to it as the kissing disease. Now, I don't know where it got that name from. I don't think that's the primary mode of transmission, but I think people like the sound of it and they used it. Mono is caused by a virus. That virus is called Epstein-Barr virus. Epstein-Barr virus bothers us when our system is at its most vulnerable. So a lot of times people have been studying a lot, they've been up late at night, they've been eating a lot of junk food, they've been doing a lot of things, they're pushing the candle, burning the candle at both ends, they have a project that's due and it's got a deadline. We're more vulnerable to the virus when we've been weakened like this. What does the virus do? Well, the virus affects three main organs in the body. It affects the adrenal glands, the liver, and the spleen. Sometimes, in the case of mono, it will actually cause liver and spleen enlargement. That's called hepatomegaly and splenomegaly. Now the adrenal glands we really can't see. They're small little glands that sit atop the kidneys on both sides. One of the symptoms of mono is fatigue. Debilitating, terrible fatigue. Usually it happens to teenagers, college students. The challenge with mono is that mono is one of those conditions that causes this fatigue, not just for days, but usually at least weeks, months, and sometimes even years. And once it goes away, it's in this classification of viruses called the herpes group. Okay, I know, but it's part of the herpes family. All right, and it's in this group that can cause chronic viral infection. So it can go away, and then years later, when you burn the candle at both ends and aren't going to sleep and just stress yourself out, next thing you know, you have this debilitating fatigue shows up again. What we try and do is make sure that people deal with it right the first time around. The common blood test people do is called a monospot, or it's called a heterophile antibody. Sometimes we can see on the blood test that the liver is affected. We'll see some liver enzymes that are slightly elevated. Most times the spleen and adrenals, we don't have blood tests to indicate are they affected. Now the medical system, most people, medical doctors, they go, you need to just go home, you need to get plenty of rest, and then you're eventually going to get over this. In most cases that's true. I don't know about you, but I don't really have a whole lot of weeks or months that I can just lay around the house. My take is I try and give support for the immune system to fight the virus. That might be vitamin C, that might mean zinc, that might mean something called monolaurin or lauric acid, that might also include something like vitamin A or lysine. There are a lot of antiviral nutrients that support that part of the immune system that fights off viruses. The other side of it is I need to support the glands that have been badgered. The idea is this virus badgers these glands, these organs, and we need to support them. So I usually give glandulars or homeopathics or different things that are known to support those glands. The key one is the adrenals, because if the adrenals are allowed to flounder, the fatigue will continue. So we need to actually help the body recover and restore and replenish. And usually we can cut the recovery time by a third to what it normally would have been. So now we've covered what is mono, and we've covered how to get over mono. I think my work here is done. My name is Dr. Michael Berglund. You've been watching Common Sense Medicine. Thank you very much for watching today. No, sorry, we digressed there for a moment. I was a badger. But I'm from Wisconsin, so I'm allowed to be a badger every now and then.